wounds. What are cuts and wounds? A cut is a break or opening in the skin. It is also called a laceration. A cut may be deep, smooth, or jagged. It may be near the surface of the skin or deeper. A deep cut can affect tendons, muscles, ligaments, nerves, blood vessels, or bones. A wound is a puncture made by a pointed object, such as a nail, knife, or a sharp tooth. Puncture wounds often appear to be on the surface but may extend into the deeper tissue layers. Common symptoms of wounds and cuts are bleeding, pain, feeling of numbness, problems with functions, and in severe cases, the wounds or cuts might get infected. Types of wounds and how to treat them. The first kind are called abrasions. Abrasions are usually the result of a rub or scrape on a rough surface, like skinning your knee on a playground or scratching your elbow on a brick wall. Typically, an abrasion will not bleed heavily, but the area should be thoroughly cleaned and washed with soap and water to avoid infection. An abrasion may require a bandage or a dressing in extreme cases. But minor abrasions should heal on their own after cleansing. The second kind are called lacerations. Lacerations are cuts, slices, or tears in the skin. Lacerations are often caused by sharp objects like knives or broken glass. Bleeding may occur quickly in the case of deep lacerations. So it is important to stop the bleeding by covering the wound and applying pressure. If bleeding is severe or won't stop, you may need to proceed to seek additional medical attention. The third kind are called punctures. Punctures can occur when any type of pointed object such as nail penetrates the skin. Puncture wounds may not bleed outwardly, but a deep puncture can cause internal bleeding. Apply pressure and rinse the wound with clean water to remove all the dirt before drying and covering with bandage. Apply antibiotic cream or ointment. Watch the puncture for signs of infection such as spreading, redness, pain, swelling, or fever. If the person with the injury hasn't had a tetanus shot in the past 5 years, a booster may be needed. It is best to get that within 48 hours of injury. The fourth kind is called the avulsions. Avulsions are serious injuries that can cause uncontrolled, life-threatening bleeding. This type of injury typically occurs when skin or body part is partially or completely torn away. These injuries often result from serious trauma such as motorcycle accidents, explosions, or gunshots. In avulsions, bleeding will occur instantly or extensively, so you should seek medical attention immediately and attempt to control the bleeding as quickly as possible. For some avulsions, you may need to apply a tourniquet to stop the bleeding. If a body part is severed, in such cases, the body part should be brought along for reattachment in the hospital. The body part should be covered in a clean cloth and packed in ice if possible. The last one is called the bloody nose. Nosebleeds are common both in adults and in children, but the most common cause of nosebleed in adults is increased blood pressure or hardening of arteries. First aid for nosebleed. Have the person sit down and lean their head forward. This will reduce the pressure in the nasal vein and slow the bleeding. It will also keep the blood from flowing down into the stomach, which can cause nausea. If you would like, use a nasal spray in the bleeding nostril while the person holds their head still. Have them push the bleeding nostril firmly against the septum. Now the septum is the dividing wall between the nose. If the person is unable to do this, put on latex gloves and hold the nose for about 5 to 10 minutes. Once the nose bleeding stops, instruct the person not to blow their nose for several days. This could dislodge a clot and cause bleeding to begin again. However, if the bleeding does not stop even after 20 minutes or if the nosebleeds are recurring, please seek medical attention as this can be a result of something severe. Thank you.